Distinguished guests, ladies and gentlemen, good morning to all of you. Let me begin by thanking the ASEAN Secretariat and the ASEAN for inviting me here as a speaker for your inaugural ASEAN Forum today. I'm deeply honored to be here. I would like to propose a number of recommendations during my remarks today, but let me forewarn you that they will not be easy for ASEAN to action, but my sense is that the pandemic has provided us with new courage, with an understanding that when faced with a cataclysmic event, ASEAN can act. It needs to do this, not once, but many times as we look to the future, and the business community has a vital role to play. Ladies and gentlemen, it goes without saying that over the past 2 years, COVID-19 has impacted each and every one of us as individuals, as family members, as communities, as nations. It has also exposed the fragility of our healthcare systems and how unprepared we were for a pandemic of this magnitude. Of course, we need to reflect on this, but we also need to embrace the fact that we were not entirely unprepared. I take the view that we have the tools at our disposal to fix what needs to be fixed at the operational level, and now have to find the will to change what needs to be changed at the political and strategic levels. Operationally, the ASEAN Public Health Emergency Operations Center, PHEOC network in Malaysia, and the Public Health Laboratories Network on responding to all hazards and emerging threats by all of ASEAN's member states are two good examples of regional cooperation and coordination mechanisms that helped us during the pandemic, and which must now be strengthened as we anticipate future pandemic threats. These mechanisms share technical expertise, risk reports, data analysis, help us to maintain use of international health regulations and standards, and thereby better resolve common difficulties and challenges across the region. Underpinning the improvement must be more inclusive and comprehensive policymaking processes through targeted and efficient dialogue forums. In this way, we can start to streamline these mechanisms better across ASEAN. Similarly, ASEAN's focus on business and sustainability can become an equally important element of our collective efforts to prevent the conditions that encourage pandemics, acting as a connecting point across the ASEAN community. We also need to recognize our successes and build on them as well. We were able to mobilize and adapt to the unfolding crisis. The closure of borders and imposition of movement control orders by most ASEAN member states in the early stages of the pandemic, and the implementation of standard operating procedures that were both universal and localized at the same time saved many lives. The pandemic also reminded us that we are strongest when local communities come together and support one another, especially during pandemic restrictions and the lockdowns. While these were difficult times for us, they demonstrated the power of community mobilization. The media landscape changed to one that is digitalized, with online meeting, business transactions and events, not to mention the apps that helped us to stay safe. The business community adapted rapidly, exercised duty of care at considerable cost, ensured risk mitigation was maximized, and played a major role in rapid development of tools and processes that kept us safe. Our leaders were tested and exercised considerable courage in the face of existential threats, something that we must remind them of as we look to a worrying future full of similar, but perhaps less visible existential threats. But where do our successes and failures leave us? And what do we do next? How do we improve our readiness and work to prevent the next pandemic? Here, I see above all else the need for a transition in how we think and talk about health. You may be as aware as I am that only 20% of our health is attributable to what our medical care systems provide. Human health relies most significantly on social, behavioral, and environmental factors. Human health relies most significantly on social, behavioral, and environmental factors. Approximately 25% of the diseases we experience emanate from environmental factors, such as toxic pollution in our lived environment, with air pollution as an increasing factor. Biodiversity loss is also a significant health disruptor. And when it comes to pandemics, generally caused by zoonotic crossover between animals and humans, and might I add that 75% of pandemics are caused by zoonotic transmission, it is estimated that an investment of approximately $20 to $50 billion annually could substantially reduce the likelihood of future pandemics through health system reform, more effective early detection measures, and biodiversity protection. Believe it or not, that's only around 10% of the COVID-19 bill just in 2020. Ladies and gentlemen, there is an unbreakable link between our health and the health of the planet. It is clear that the current focus in the medical fraternity and the pharmaceutical industry on human health has been at the expense of planetary health. It is now past time to recognize and address this imbalance, and the adoption of a broader planetary health approach can do this. This planetary health concept, a somewhat revisionist way of looking at health, may be new to some of you, and it is relatively recent, first introduced in The Lancet in 2015. A planetary health approach takes a holistic view of the relationship between our health and the state of Earth's natural systems, and proposes that stabilizing our planet's natural life support systems is essential for safeguarding a livable future for humanity. Over the years, we have sacrificed the environment for the development of our countries, almost nowhere more so than in our 10 member states, where we have seen phenomenal development. But at the same time, staggering destruction of nature, terrifying levels of water, air, and land pollution, and a startling disregard and disrespect for nature. And now our consumption patterns have exceeded the capacity of the planet to meet our desires rather than our needs on a sustainable basis. See ASEAN's push to ensure that business is sustainable and that it plays its part in addressing the unfolding horrors is welcomed, but needs to be joined up with the emerging broader planetary health agenda. It is this crisis that is my primary driver to keep working, keep pushing, keep talking, and keep advocating for a fundamental change in what we consider valuable and important in terms of health. I was asked to provide recommendations for See ASEAN on public health response and readiness and preventing the next pandemic. So let me suggest the following. Firstly, can See ASEAN help the association to find the courage to provide global leadership on a planetary health approach to human health? See ASEAN can support our leaders here, supported, if you so decide, by the Center for Planetary Health that a few of us has set up at Sunway University, the role of which is to undertake research and education on planetary health and provide information and evidence to promote change. Secondly, as ASEAN starts to prepare for its next blueprint to follow the one that will complete in 2025, can See ASEAN play a role in helping the ASEAN family advocate with other UN member states for a planetary health approach to the successor goals that will follow the SDGs? Quite simply, placing endless growth at the center of our consciousness means that health is sacrifice, planetary and human. So as the business community, how can you help to find the answers and promote those in the follow-up to the 2030 goals? Thirdly, let us educate ourselves on the planetary health threats that we face. As the saying goes, everything is connected. But because that is the case, the complexity of working out what we can do and how we need to do it needs to be a collective and an inclusive effort that is not restricted to academia, but which engages you, the private sector, other economic sectors, and across civil society, especially reaching out to those who are likely to suffer worst and at the same time have the most limited ability to share their views. But the business community needs to play a key role here, in my view. In concrete terms, where you as the business community have responsibilities to your customers and their families, to your employees and their families, to your suppliers and their families, and to the ASEAN family of nations, strengthen your resolve to fund programs and projects that enhance and improve planetary health, that spread the word on risk management and mitigation, an area where the private sector has shown it excels. Let me remind you that COVID-19 is not the first, nor will it be the last pandemic that we face. We need to be ready. But we also need to look beyond pandemics. We need to be prepared for other disasters, especially those related to climate crisis. And it is a crisis. Recently, I participated in a series of meetings and spoke at the Connecting Business Initiative at the United Nations. I'm proud that this platform was established during my tenure at the United Nations, but it needs to grow. ASEAN businesses need to engage and learn from each other. So I highly recommend you explore being a part of this. But even with the Connecting Business Initiative, we are pushing them to think beyond preparedness and response, but a reframing of how we solve the problems of recurring pandemics in the future and colliding climate threats, which are here to stay. The silos of what is clearly an interconnected set of risks needs to be broken. The planetary health lens can provide that much needed framework. Frankly, there isn't a moment to lose. These are not future threats anymore. They are upon us. They are a direct consequence of the impact that we have on our environment, and they have a significant bearing on human health. We have to own this. We have to adapt, and most importantly, we need to be prepared. ASEAN has a key role to play here, and ASEAN Shield is a clear recognition that the association and its member states need to step up. I applaud the adoption of Shield and urge that it is not simply a talking shop, but a way for the three ASEAN pillars to come together, working closely with member states to make sure that our family is ready and that we are allocating intellectual capital and financial resources accordingly, and that planetary health is hardwired into ASEAN Shield. Ensuring adequate multi-stakeholder engagement in ASEAN Shield will give it impetus. See, ASEAN can play an important role here. So, perhaps not what you were expecting. If so, I'm not sorry. My aim was to get your attention, and I hope I've done so. My 4 recommendations are broad and focused at the policy and political levels. ASEAN should lead global thinking on the planetary health and human health relationship. ASEAN should urgently start the process of considering what comes next after the SDGs. ASEAN stakeholders should work together on these issues in support. ASEAN stakeholders should work together on these issues in support of our leaders, challenging them when needed. Operationally, ASEAN is already working, but more can and must be done on risk management, on financing, and making the link between the business decisions that you make and the broader health impact they have on the families of those you work for and with. And finally, remember that politicians change things, but usually only if they are pushed. It is time to push, perhaps despite rather than because of the ASEAN Charter. If we don't act rapidly, COVID-19 will feel like nothing more than a rather timid dress rehearsal. The 2022 Edelman Trust Barometer has named the business sector as the most trusted sector, exceeding civil society and governments. With that trust comes great responsibility. We call on you, members of ASEAN, to take that responsibility and to act. Thank you very much.